Good afternoon, everyone. Thank you for coming to our press conference that we are hosting for Chief Clinton Keeper of Little Grand Rapids First Nation in Manitoba. My name is Melanie Ferris. I'm the Director of Communications for the Southern Chiefs organization, and I'm very glad to be here. We have multiple leaders joining us, and I will tell you their names and titles right now. We have Grand Chief Jerry Daniels of the Southern Chiefs organization, Manitoba Regional Chief Willie Moore of the Assembly of First Nations, Grand Chief Kyra Wilson, Assembly of Manitoba Chiefs, and Grand Chief Garrison Settee of Manitoba Keewatinowi, Okimakanak. So we're going to hear from Chief Keeper on his experience accessing healthcare in Manitoba recently, and then he is going to be followed by all of the other leaders. So I'm going to invite him to come up, and then at the end of all the remarks, we're going to open up to questions from the media. So Chief Keeper.
Bonjour, Anin. Sagche Gabondish Nikas Namento Tem Shibatigong Donji Dogimaka Niwatin Shibatigong Ganin Wenjian. I'd like to say thank you to everybody that's in this press conference here to give a statement on how our people are being treated. But I also want to say I'd like to thank the Algonquin here, their territory, Umaga Yange, Pimochuing, Umaga Bunashoing, Umaso, Miwech in the Nag. I experienced certain things in the system of the healthcare in Manitoba. I'm also a cancer survivor. 2014, I had my stomach removed, my spleen, and half of my pancreas. I barely survived that operation, and I've been struggling ever since, but I do the best I can to live again. I experienced serious medical emergency after developing complications from a kidney stone, and it was initially assessed, and I was sent home. The first time I went, I was hospitalized for 7 days. I got admitted. The first time I went there, everything was good. And then I got better after 7 days, so we thought. So I got antibiotics and I was sent home, only to come back a day or two later under ambulance again because I was suffering really, really excruciating pain. And everything I ate tasted like salt. If I drink juice or strawberries or blueberries, it tasted like salt. So I knew something was really wrong, and my heart was starting to race, and I was really sick. So I went back in. So getting to the Grace Hospital, they told me I can go back any time if I get sick. So when I got there, they put me on a wheeled bed there. 13 hours I was in that bed. Everybody else that came that's non-Indigenous was seen almost right away, making them comfortable. They got their morphine, their pain medication or whatever. But it was me there for 13 hours. I got nothing whatsoever. So finally I told my sister and then to bring my Tylenol 3s. I have a prescription for that. And that's what I had. They had to bring in. They just gave me regular Tylenol when I was there. And then they told me to provide a urine culture, a urine sample. So I told them I'm too weak, I'm dizzy, I can't get up. So the nurse there gave me one of those urinals, so I used that. And I was so weak and confused and tired, I dropped that urinal on myself. 13 hours, I tried asking for new sheets and stuff. So I just lay there in my own urine. My sister used to be a healthcare aide. She had to come and change my sheets when I was in the hospital. And there was a guy that was by my feet there, an Indigenous guy. He was in a lot of pain. It almost looked like something was sticking out of his side there. So that nurse came and said, well, we got a bed for you in the room, so you better grab it now, because if you don't, you'll have to wait here longer, and you have to walk there. But that bed he was on has wheels. They could have just wheeled him in, but they didn't. She still made him walk. So those are the things that are happening to our people. and you can hear them whispering, oh, they're probably here for their cheap morphine shot or something, their fix. Not all of our people suffer that, you know. And that is when I called the Grand Chiefs here to see what they can do to help me to access proper service. And I reached out to Kyra and Jerry Daniels, Settee, all of them, and the National Chief. And Jerry made time to come see me at the hospital. And he talked to the doctors over there. He was very outraged on the treatment of our people. And those are the type of people we need to speak for our people, not just for chiefs. What about the regular person, you know, that doesn't have that title? Once they found out that who I was, the health minister apparently called Grace Hospital, and then I had a bed in 10 minutes. But what about those other people that are suffering? Our people are dying. They're allowing our people to die. And the last part I'm going to share is I asked to be transferred to somewhere else to get a second opinion. They said, no, you'll be fine. We'll give you a prescription. You can go home. You're not going to die, Clinton. That's what the doctor said to me there. But I want a second opinion, so I reached out, and Melissa Robinson works for MC. She was there with me from day one, every day. She took me to HSC. I got admitted immediately over there. I was really sick still. They were surprised why I was going to get discharged. And then one of the doctors that came to see me, she must have seen my chart and stuff and information, she says, and she's not from, she's a different ethnicity from a different country, a female. And she said, I worked there for 2 years in the ER. I myself, as a doctor, faced racism and discrimination, she said. Grace Hospital in Winnipeg is, in my opinion, is a racist hospital. But not all of them, because I had 2 nurses, one blonde, one brunette. They were so tentative to my needs and the others. And they said, it's important what you're doing. Never be afraid or shy to show everybody what's actually going on. I said, because if nobody does, it'll just continue. And why I say that, not all white people are bad, but there are a few bad apples that create this, and our people just die there sometimes. And one last part, I told my counselors, I'm going to throw that in there. It's Augustine Keeper, my counsel, and Wendy Levesque. In Little Grand Rapids, it's a fly-in reserve. At that time, when I was sick, 2013 and stuff like that, I got medevaced out, 2014, I think. And then the nurse in charge at that time said, there's $50,000 of my tax money again. Boom. 3 medevacs. That's 150 grand of my tax money. So I said, if I get in as counselor, I said, you're going to be the first one I'm going to come after us. And I got in, and he left right away. So this is still going on, and even now, 2026, is still going on. We need to work together and address these issues. Enough talking, let's get things done. But I'd like to thank these Grand Chiefs and National Chief and them for coming to show their support and to voice for our people. And also the chiefs here, my good friend Blue Sky, Rochelle, Lisa, all the chiefs, and even across Canada, we still face the same issues. So let's stand together and get things done. And sometimes we have to be really loud to get our message heard. So, but anyways, I went over my limit. But miigwech tinnim kabizindo ega gagi doan miigwech.
I'm going to ask Grand Chief Jerry Daniels of the Southern Chiefs Organization to come to the mic.
Matakiapi, Anin, bonjour. My name is Jerry Daniels. I'm the Grand Chief for the Southern Chiefs Organization. I just want to acknowledge the First Nations leadership that is here in the room with us today, the health professionals, advocates, citizens that are here in Ottawa. The Southern Chiefs Organization is calling for urgent national action to address the barriers First Nations people continue to see and to continue to face in the emergency medical care. First Nations citizens are continuing to die 11 years earlier than the average Canadian. And I want that message to ring hollow to everyone who's listening right now. First Nations people are dying 11 years earlier. Think about that when you think of your family and care, or when you think about those that you love. that they are passing away so much earlier, not through natural cause, but through systemic barrier, through systemic challenges and racism that our people are facing. Across Canada, First Nation citizens have to travel hundreds of kilometers to go into a system that is creating long wait times, language barriers, mobility issues, unfamiliar systems, and continued discrimination. In Chief Keeper's experience, hours and hours on the gurney in a hospital hallway medicine, because there's nowhere else to receive care. It demonstrates the human consequences of these failures, and no First Nation should ever have to feel invisible, unwelcome, or less deserving of care. While this happened in Manitoba, First Nations across the country are feeling this. Evidence confirms that these experiences are systemic. In Manitoba, First Nations patients experience some of the longest emergency department wait times in the country. Our citizens are nearly twice as likely to leave without being seen, even though they require urgent care. We recognize the dedication of physicians, nurses, paramedics, and frontline health workers. They are serving our patients under extraordinary pressure. Governments must provide them with the capacity and resources that are needed. Canada and the provincial crown must show leadership and work together to reduce overcrowding, shorten these wait times, and create a culturally safe and equitable space for our citizens. First Nations patients, navigators, and health advocates must be available in every single hospital, 24 hours a day, 7 days a week. But navigation alone is not enough. We are working towards health transformation for 92,000 Indigenous, Anishinaabe and Dakota citizens in southern Manitoba. We're working towards a First Nations governed and led health system based on best practices that is culturally responsive, that will focus on changing the culture within shared health, within the health authorities throughout the province. And this work is to empower our citizens so that they can access care, so that they can have culture and language supports. Inherent right to health services are designed and delivered through this kind of process. Canada must support First Nations in establishing that authority throughout the entire province, creating long-term funding envelopes, and reducing the required First Nations challenges within the bureaucratic system. We can operate our own systems, and we showed time and time again that we create better outcomes. And so timely, safe, compassionate, respectful health care must be the expectation that every First Nations across Canada needs. In the case of Chief Keeper, that should never happen. And he witnessed the treatment of not only what he experienced, but those of our people as well. And that is the culture of the healthcare system that we currently see in Canada, and it has to stop. And it takes leadership at the national level and leadership at the provincial level, and not pointing towards all of the reasons why we can't do this. We can do this. It takes leadership. Miigwech, Padamido.
Miigwech, I'm going to call on Grand Chief Kyra Wilson of the Assembly of Manitoba Chiefs.
Ani and Buju. Good afternoon, everyone. My name is Kyra Wilson, Grand Chief for the Assembly of Manitoba Chiefs. I just want to say thank you to everyone that is here. Thank you to the media for being here, and of course, Chief Keeper and the other Grand Chiefs, as well as all of our leadership that are here. I recognize all of the hard work with our leadership every single day. And this is one of the many issues that we continually talk about today and over several years, generations, that this issue is still ongoing today. And, I want to begin, of course, by acknowledging that we're gathered today on the unceded, unsurrendered territory of the Algonquin and Anishinaabe Nation. And so I just say thank you, Chief Keeper, for your courage to share your experience and your leadership in calling for the improvement to emergency health care, but also improving health care for First Nations citizens, not only in Manitoba, but also across the country. It takes a lot of courage to speak about your own journey in your own health, especially as a leader, because our leadership, they deal with so much every single day. They govern their nations, deal with crises, and usually, our chiefs, our leadership, their health is put on the back burner. And so I uplift you today, Chief Keeper, for bringing this forward and having us all gather here. And so, of course, with the Assembly Manitoba Chiefs, we represent 63 First Nations in Manitoba. And today we are speaking about access to safe, timely, and equitable healthcare that not only matters to every single person in Manitoba, across the country, but as First Nations people as well. And so we know as First Nations, citizens talk to leadership every single day about how they're not receiving proper health care. Everyone deserves equitable access to fair health care, treated with dignity, respect. And that is something that we continually hear is not happening with First Nation citizens in Manitoba. As Grand Chief Daniels had mentioned, many of our community members travel hundreds of kilometers, miles to access health care. And, it's a challenge to not only deal with, an illness or an injury, but you have to leave home, and then you have to navigate an unfamiliar healthcare system while you're dealing with all of that. And as Chief Keeper had mentioned, not every single individual has the ability to have somebody there to advocate, to talk for them. Sometimes there is language barriers. The healthcare system has not been nice to our people. And that is something that Chief Keeper is talking about today, as well as our leadership, that things need to change. And we know in Manitoba, also across the country, that there's a lot of pressure on the healthcare system. We know that. But what we're saying is that government needs to talk to the leadership. They need to work with us to identify, these gaps that our people face every single day. People are talking about long wait times, feeling dismissed, feeling unheard, feeling unsafe while seeking care. Those experiences must be taken seriously. They need to be investigated appropriately, and we need to address all of these issues and look and see improvements within Manitoba's healthcare system. We look at the evidence that is there. There has been so many reports that have been done that speak to the inequities of First Nations people within the healthcare system in Manitoba. And just recently in 2025, we had the Manitoba Race, Ethnicity, and Indigenous Identity Report that examined 618,000 emergency department visits between 2023 and 2024. And so that report found that First Nations people had the highest rate of emergency department visits in Manitoba, but it also explains a greater health need and the barriers of accessing primary care. The report also found that First Nations patients experience some of the longest emergency department wait times and are among the most likely to leave before actually seeing a physician. So when you think about the longest wait times, that also reflects, the need for fair and equitable health care services. What we saw, or what we've heard in that report, is that First Nations people would have the same issues as, say, a non-Indigenous person, but they still experience longer wait times in the emergency room. So we don't understand what the disparity is in terms of healthcare services and how our people are treated in all hospitals, all clinics, healthcare in Manitoba. And we have, you know, the answers, the solutions. We have so many leaders that have been talking about this for years. And so when we look at those numbers, you know, every number is a person. They have families and they have communities that are waiting for them to come home. And so we recognize the dedication of the nurses and the doctors, paramedics, frontline healthcare workers that are serving Manitobans, First Nations people. Our concern is not with the people that provide care. Sometimes it might be, because we do know that racism does in fact exist in the healthcare system. There are some people that treat our people well, and there are some people that choose to go down another path and ignore the voices of First Nations people within the hallways of some of our hospitals. And this is something that Chief Keeper experienced, which is, to me, is not okay, and this needs to be addressed. We can't accept these inequities anymore. And so with the work of all of our leadership, we stand here together today, you know, with all of our nations, all of the citizens, and just letting the province of Manitoba know, as well as the federal government of Canada, that we have the solutions. And this is something that we say with every issue that we talk about. We have the solutions, we have the answers, all the research and reports are done. Come and talk to us, come and sit down with us, and we will figure out together how to fix this problem. Because if we continue to hear about people that are being treated unfairly in the healthcare system, then we are going to have to do things to change that. And sometimes that means forcing the hand to ensure that change is happening. And as you see the leadership here that are standing here today, you know, as well as all of our First Nations leadership, they are wanting to see that change. And I just want to say thank you again, Chief Keeper, for inviting me to speak on this important issue today. And of course, I'm going to be with Chief Keeper, all of our leadership, all of our citizens, every step of the way to ensure that we see changes in the healthcare system. Miigwech.
Okay, Grand Chief Garrison Settee.
Avtanse, bonjour, Anin, Hamitakwapi, Atlanite. First and foremost, I want to acknowledge Chief Keeper for his bravery and for his courage after going through an ordeal that no one should be subject to in the healthcare system that we live under in Manitoba. So I want to say thank you, Chief Keeper, for raising this issue. And as my colleagues here, we stand in solidarity with Chief Keeper. And in Manitoba, in 2008, one of our relatives died in a hospital after waiting 34 hours to receive care. And in 34 hours, Brian Sinclair died in the hospital. For a brief moment, we thought that things would change. But since 2008, nothing has changed. As a matter of fact, it has gotten worse. The healthcare system in Manitoba is harming our people. It perpetuates systems of racism. discrimination. And it's not that we as leaders have not tried to speak out. We have. We continue to speak out against racism in the healthcare system. But it still exists in many forms. But as leaders of our people, we are here to propose a change and transformation in this system. And the only way that system will change is if we take over. The only way to eliminate racism in these systems is if Indigenous people take over. Because the current healthcare system has no compassion. Leaving people in hallways for hours is unethical. It is wrong that anyone should be subject to that kind of treatment when they're reaching out for help, when they're reaching out to find some comfort in a system that continues to fail. It has failed for a long time and continues to fail because people in levels of government that have the power to change things are not acting on our behalf. So we cannot continue to let our people die in these hospitals. We cannot allow any more suffering in healthcare systems that disregard the importance of our people. This is unacceptable and it should not be allowed to continue, and we're calling on governments federally and provincially. Change the system, it's failing. Why do we continue to keep perpetuating a system that brings irreparable harm to our people? We are human beings. Our people are human beings. They should not be treated as less. And we're demanding change. We're not asking for change, we're demanding change. We will not let our people go through these ordeals anymore. We're going to shake the system, we're going to rattle the cage until there's transformation. And that time for action is now. Let's do this.
Thank you. Our final speaker for today's press conference is Manitoba Regional Chief Willie Moore.
Hello, dancer get the Thumbscott now, Gagado. And first of all, I'd like to give thanks for our relatives for letting us gather here in the territory of the Algonquin peoples. My name is Willie Moore, the Manitoba AFN Regional Chief, here to stand in solidarity and support our Chief Keeper from Little Grand Rapids, alongside our fellow leadership, Grand Chief Daniels, and Chief Wilson, Grand Chief Settee, and Chief Bunn, Chief Young, Chief Blue Sky, Chief Desarles, Councilor Leadership, Youth Chief, proxies. It was already mentioned numerous times, repeated. The healthcare system in our region needs to improve. Now it is time for our region to have a First Nation health ombudsman. Our relatives in Saskatchewan are the only ones that across the country that do have First Nation health ombudsman to ensure that their people are getting the proper care and treatment. Today we stand together because this is about something fundamental. This is for the right for our people to receive the safe, equitable, and fair and cultural appropriate health care. It was mentioned by Grand Chief Kyra Wilson, Manitoba has the data, the Manitoba race, ethnicity, and Indigenous identity, where you got to declare your First Nation when you go seek, professional health services. You say professional because we go to those urban centers because those health services are not delivered in our community. So we seek that professional health services in the urban areas. Is it professional? And if you were to grade it, it'll be a big F. We're disadvantaged right off the bat. The data shows that. The data provided by organizations such as like First Nation Health Social Secretariat of Manitoba, disadvantaged because of our skin, disadvantaged because of our postal code, disadvantaged because sometimes we don't have no identification, the language disparity. The facility that Chief Keeper at first sought proper care that failed him is the same facility where they amputated the wrong limb for one of our relatives. And this is professional services that we're supposed to seek. And you go into, you expect to go into a hospital to come out well. You don't expect to go into a facility, you're half dead, and you're just about, didn't make it. And that's the experience one of our chiefs went through, which is unfortunate. Our people deserve to live long and healthy lives, not 11 years younger than the average person. Our children deserve a future where their postal code or First Nation does not determine the quality of care they receive. It is our duty to ensure that there's patient advocacy, mechanisms for dispute resolution, mandatory Indigenous cross-cultural component in their licensing, such as when you do it in the Law Society, when you have to renew your certification in the legal area. The data is there. Our people have been studied. One of our First Nations long-time leaders, the late councillor in my community, Darcy Linklater, said our people have been studied to death. And we shouldn't go into these facilities coming home in a coffin. We should be going home to our families healthy. So again, folks, media, together we will continue to advocate, to hold the governments accountable, and to ensure that all our relatives, First Nation citizens, and our children can access the care that they deserve, but more importantly, dignity, respect, and without barriers. Here to stand in solidarity with Chief Keeper, and it's fortunate he had to, go through that experience. But the word that he is, he's going to ensure that it doesn't happen to anybody else, and that can be avoided if the right plan is in place, and we do have those answers. Yeah, so, with that, Musani, thank you very much.
So that wraps up our presentations, and I just want to ask if there is any questions. Chief Keeper is not going to be taking any questions, but he has asked that the leadership respond on his behalf. So I'll just look to the media and see if there are any questions, and if not, then we can just wrap up. Everyone seems to have what they need, so thank you for coming.